Okay, good morning students. Today's topic is health educations. Health educations will helpful in your all the terms, in all the subject, in all the areas, all the communicable in non-communicable disease controls, all the disease prevention, promotive and health that will helpful as by the health education. Now definitions. What is health educations? Process which affect change in the health practice of people in the knowledge, attitude and the related to the such changes. Health educations, by the health educations we are providing the changes, some changes in health practices. By health educations they may change their attitude, they may behave like positively. Also their knowledge will be going to improve by the health educations. Another one, teaching process providing basic knowledge and practice of the health as to be interpreted into proper health behavior. It also helpful in the providing the knowledge and practices towards the health by promoting and preventing the health, curative and rehabilitative health, also impacts on the proper health behavior like good behavior. They easily also helpful the holistic controls like holistic maintenance of the health, that will increase that psychological support, that increase that physical support, that increase that spiritual life, also that helpful for the healthy behavior. Now aims for the health educations. First one is health promotion and disease preventions. Health promotion in the terms of the we have to provide the health promotions towards the well-being of the health, and the disease prevention before occurrence of the disease we are going to provide the preventions to reduce the signs and symptoms, to prevent the occurrence of the disease conditions before occurrence of that. Second one is early diagnosis and management. Early diagnosis in terms of the firstly after showing the signs and we are going to give the some investigations. Afterwards we are going to come see under the diagnosis test, that is called as a early diagnosis. And the management in the terms of the after showing the signs and we are providing the reducing the signs and symptoms, we are providing some medications, non-pharmacological management and pharmacological management to provide the well-being to reduce the signs and symptoms, that is called as a management in terms of the pharmacological and non-pharmacological. Third one is the utilizations of the available health services in terms of the government services, in terms of private services, by the help of the agencies, by the help of the health programs, which is provided by the governments and private sectors or by the agencies, that is called as the utilization of available health services. Like PSC, CHC, government hospitals, district hospital comes under this utilization of the health services. We provide the free of cost services, we provide the certain specialty of services, comes under this health services, called as a health sectors also. Now specific objective for the health education. If we have provide the health education, we have some aims, we have some objectives, we have some promo. First one is to make the health assess valuable by the community. Firstly, we will provide the make assessment. We have to provide the assessment. We are going to do the assessment on the health by the checking of the vital signs, by asking the closed and open questions to the community. Then second was to increase knowledge of the factors that affect the health. If we are going to provide the knowledge affects the factors like mode of transmissions of the infections, mode of transmission of disease controls, like that we are going to provide the knowledge about the factors which we improve their health. Also we are going the knowledge on the factors which promotes towards the disease conditions, so we can break down, we can go the prevention of any disease condition by the providing the health factors knowledge. Then third one, to encourage behavior which promotes the maintenance of the health. We have to encourage the behaviors like good behaviors like nutrition, level behavior. Then they have to go for the exercise, they have to go for the yoga, they have to go for the positive thinking, that is called as encourage of the behavior towards the health. By promoting their health, by promoting their mental status, psychological supports and the health knowledge. Fourth one is to enlist support for the public health measures and when necessary to praise for the appropriate government actions. Then we are going to enlist the public health centers. We are providing the knowledge about the PSC, CHC, we are providing the communicable disease controls programs. We are providing the knowledge about the non-communicable disease control. It is called as a public health measurement, which improve their health, which is necessary and which are bind for them, which is also made for them, which is appropriate with the government actions. If we are going to provide the knowledge about this ad, we are going to take the appropriate actions as like government. We are also providing the advertisement by the news. We can also avoid their health. Now, adoptions of new ideas on the practice. There are 5 steps which we can improve their health by the practices. First one is awareness, that is called as an acknowledgement of the community. Second one, interest. Interest, that we are going to give the home-to-home delivery by our interest. We are going to provide the health educations to home, that is called as our interest. Third one is evaluations. Evaluations, it means we are going to see the health acknowledgement, advantages and disadvantages. If we are providing the acknowledgement, we have to be evaluate our ratio, that if they have taken the positively or negatively. Then trial base. Trial base is we are going to provide these practices like yoga practices, like antenatal and postnatal care practices. That is called as a trial practices. That is, we are going to give this some demonstrations for that practices at the home. Then fifth one is adaptations, like habits, like we are going to give them habits of running, jogging, habit of good nutrition food, habit of vegetables. That is called as a habits. Like good habits, if they have adopt, they are going to improve their health by themselves. Also, their immunity will be also going to raise by the adaptations of good habits. That is about the 5 steps of adaptations of new ideas and practices. Now, stages for the health educations. There are certain stages. After stages, we are going to see the health educations easily. We are going to deliver the health educations. We are evaluate the health educations factors easily. Someone is a stage of sensitization. Stage of sensitization means we are going to assess which area are needed most sensitizations, which area are needed more health education, that we are going to assess. That is called as a health stage of the sensitization. Second one is the stage of publicity. Publicity, it means we are going to give the health education on public. Like health education is morely motto on the communities. Like we have to gather the people, then we are giving health education by the charts, demonstrations, by the certain activities, by changes their good attitudes, by changes their behavior. That we comes under the stage of publicity by the attend some activities. Third one, stage of educations. Stage of educations which we are going to give by the orally, by the written form, by the poster making, by some advertisements, some news. That is called as a stage of educations. Fourth one is stage of attitude change. State of attitude we are going to give by the open and close-ended questions and by their inquiries. If we are going to ask them questions, what we are going to know? We are going to know that how their attitudes on towards the health by the open and close-ended questions. Stage of the motivation and actions. Stage of motivation and actions in terms of the motive activities and the actions, like we are providing the motivations on the exercise. Like this is the most motivators right now. So their immunity also raised, their obesity also going to prevent by the motivations and actions. Then stage of community transformations by social changes. Stage of community transformations by the, if their family will be going to adopt our health educations, they're also adopted by the children. So firstly, we have to go for the community transformations. We have to mainly focus on the age group of the persons, like age group of the youngest persons. If their attitude will be going to change, their children's attitude is also going to change, their family attitude will be also going to change. So mainly focus, we have to go for the community age people of the 15 to 45 age, because they are easy to adapt the any educations. Now, contents of the health educations mainly for the personal hygiene, because now right now personal hygiene very important for the reducing the communicable diseases, reducing the any non-communicable diseases, also reducing the STD also. So personal hygiene is very important for all. for all age people. Then proper health habits by the habit by the nutrition habits, yoga habits, exercise habits, that is called the proper health habits. Then nutrition education in terms of the vegetable food, fruits, juices, that is called as protein content diets, carbohydrate content diets, that is called nutrition educations. Like infants and the children need the more proteins. All SMS aged people needs the more proteins for their immunity, for the skin turbidity, that is called as a nutrition as per the age. Then personal preventive measures, personal preventive in the terms of the PPE use, like personal protective equipments, we are using the sanitizations, we are using gloves, mask, caps, gowns, that is called the personal preventive measures in terms of the PPE usage. Then safety rules. Safety rules in the terms of the social isolations, which we are providing the social isolations by reducing the contact from one person to another person, reducing contact by hand-to-hand contact, that is called the safety rules. Then proper use of the health services. Proper use of the health services, if we have to go, then we have to awareness about the PHC, CHC and primary health centers, which provide the easily services to the directly to the community, that is called as the usage of the health services at the primary levels. Then mental health. Mental health, if we have to provide, then we have to go for the home-to-home delivery and provide the psychological support. In privacy, if we are going to provide the privacy, like women, if we are going to provide the STDs acknowledgement to the woman, what their mental health will be going to this, that educations towards the sex, that will also going to be increased. The psychological supports will be also going to be increased. Then 8.1 is a sex educations. It is very important for the all the age of the peoples, like for the puberty, that is very important for sex educations. For the age of the 25 to 45, that is called as a reproductive age, that is mainly for the conceiving age. So sex education is mainly useful for the all the age, mainly for the girls and boys both, because if they are not aware about the sex education, they are easily prone to get the STDs in their age. So we have to give the health educations on their sexual activities and the various matters. Then social educations. Social education in terms of occupational, women empowerment, that is called as a special education on the societies, that is called the occupational diseases. Then this is about the occurrence on the social activities, that is called as a social education, that we have to provide the special educations on the mothers and the childs and the occupational workers. Now, principle of the health educations. First one, principle of health educations, we needed the interest to raise in the activities, to raise in the acknowledgement towards the community. Then participate in terms of the team work. We have that team that we can easily bind the community. We can easily deliver the acknowledgement to the community. Then process from the known to unknown. Process from the known to unknown means if we are knowing the some health related benefits, we have to provide the benefits to the unknown persons. We have to educate the unknown persons who are not knowing the health benefits. Then comprehensions. Comprehensions in terms of the comprehensive care. Comprehensive care, it means the persons to persons care. Reinforcements of the repetitions. Reinforcements repetitions, it means we are going to give the follow-up. If we are after the health education, what we are going to, we are getting the feedback form. After feedback, we are come to know that how health education they have taken in positively way or they have taken in negatively. That is called informants by the repetitions. Then motivations. Motivations we are going to give the by the holistic approach. Learning by the doing. Learning by the doing, it means the we are providing the some activities to by like people, facts and medias. We are using the medias. We are using the news, super specialities, authorities like Narendra Modi. Narendra Modi is right now going to be convert the health educations by their advertisement, by news about the corona. So this is called about the learning by the doings, by people to people activity, facts to facts activity, and by the media's helping of the super facilities members. Good human relationships. Good human relationships, it's mainly by the intrapersonal relationships. If they are providing their personal health factors, the another one, what they are easily bind to the intrapersonal relationship. Then leaders. If we provide the leaders like Sarpanch is the main functions in village. If we provide the health education to their Sarpanch, they also aware about their communicable disease, their village areas, epidemiology of that village, and also disease of that epidemic areas. So we have to useful this test factor for the principle of the health education. Thank you everyone. So this is about the health educations, where we have seen their components, we have seen aims, definitions, and the principles. And very important is the interest. Interest is very important by providing and by gathering the health educations for take and for the give. Thank you everyone.